Hello, I'm Dr. Sagar Lonial from the Winship Cancer Institute of Emory University in Atlanta, Georgia. And we're going to be covering some of the practice-changing abstracts at ASCO and EHA in 2020. I think this was a really exciting ASCO and EHA two-week interval here with lots of new and exciting data that was presented. And I'm just going to hit a couple of important highlights. I think one of the probably most important and largest trials that was presented was at the plenary session where the Endurance trial was presented. And this trial was a randomization for newly diagnosed myeloma patients to receive either VRD as induction or KRD as induction. So switching out bortezomib and replacing it with carfilzomib. Over 1,000 patients were enrolled on this trial, and there was a second randomization of continuous lenalidomide maintenance versus only 2 years of lenalidomide maintenance. But what was presented at the plenary session at ASCO was actually the primary randomization, which was VRD versus KRD. And I think what was really quite important is that there was very exciting data using KRD in small phase 2 studies that suggested perhaps the depth of response and the durability of response might be better with KRD than we see with VRD. What we learned from this trial was that there was absolutely no difference in progression-free survival. There was really no difference in overall response rate, and the differences really panned out to really two different sets of adverse events. If one looked at cardiac, hypertensive, and thrombotic adverse events, much higher in the carfilzomib group. If you look at peripheral neuropathy, much higher in the bortezomib group, although again, a majority of that was grade 1, grade 2. Similar for the carfilzomib experience as well. A majority of those adverse events were grade 1, grade 2. So I think this is a really important non-practice changing abstract because it was such a large randomized trial and ultimately demonstrated that there was no significant difference between KRD or VRD when used in the newly diagnosed setting. Now, another trial that we saw at EHA was presented and looked at the combination of isatuximab in combination with carfilzomib and dexamethasone versus carfilzomib dexamethasone, the IKIMA trial. This was a triplet versus doublet using the newer anti-CD38 isatuximab. And what we saw from this trial was that the addition of ISA to CARDEX clearly improved progression-free survival, overall response rate, and depth of response, and that this was not associated with a significant increase in adverse events other than typical adverse events we see with anti-CD38 monoclonal antibodies. Now, the next two abstracts that I'm going to briefly touch on are abstracts that were presented in the refractory myeloma setting. And the first is the KIMA trial. And the reason that KIMA is important is this will hopefully be the registration study to get CAR T cells in myeloma approved in the US. And this was a BCMA-targeted CAR T cell. What we saw was that the overall response rate was very high, between 80 and 90%, depending upon the dose of CAR T cells that were used. And the median PFS and DOR was about 11 months. And that, again, was consistent with the phase 1 study testing the BB2121 construct in myeloma. And again, this demonstrated similar safety and efficacy to what we saw in the phase 1 trial. Now, the last trial that I'm going to touch on was the Dream2 study. And I want to touch on Dream2 because this also targets BCMA, and this was a 13-month follow-up in terms of the Dream2 randomized study of 2.5 versus 3.4 milligrams per kilogram of the BCMA-targeted antibody-drug conjugate. And what we learned in this update with a 13-month follow-up is that the median duration of response was 11 months, and that the response rate, again, remained over 30% for both doses. And this is important because we hope that this antibody-drug conjugate will be the next approved drug in myeloma. So as you've seen from this summary, lots of really exciting, important data. I've only touched on a couple of highlights, but please pay attention to some of this EHA and ASCO updates because there's a lot of really important data from other phase 1, phase 2 clinical trials suggesting that the outlook for patients coming forward is really quite good, and it's an exciting time in myeloma. Thank you for your attention.